Well, welcome everyone. January 7th, it is January 7th, yes, isn't it? Meeting of the Georgia Department of Human Services Board. I appreciate all of you being here, and as well as those of you who have joined us online, whether you're a board member or not, or whether you're just a citizen or someone who likes to keep up with the business of this department. We welcome you. As an open meeting, and we're here to do business for the people of our state. We appreciate your attendance in any way. Can we call attendance? Board members Monica Walters and Dave Barbie are here across the table.
Yes.
From me, I am Scott Johnson. I'm acting as chairman today in the absence of Chairman Randy Smith. So, Randy, we wish you well, and we know you'll be joining us at the next meeting. Is Jack Williams? Is Jack Williams online?
Online.
I am.
Doug
Thank you, Jack.
Aldridge, Wes Lewis, and Lisa Hamilton.
Okay. Since I was so we've got Jack is online. You say Wes is online?
Yes.
Okay. And who else is with us online?
Lisa.
Lisa.
Hey there.
Hey, Lisa.
Hey, Lisa.
And
Hello.
Wes, all of you. Thank you for being
Wes.
here.
Have we got pictures of all of y'all so we know that you don't have fuzzy hair or something?
Very good. We will start with program reports from our departments. First up is John Holman with our Deputy Commissioner of Office of Family Independence. John, welcome. We're glad you're here.
Thank you. Glad to
Update
be
us.
here. Glad to be here. Good afternoon, members of the board. As you said, I'm John Holland. I think we've all met before. Happy to be back. Sorry for my absence from the last meeting and accepting my stand-in of Laura Beggs. I heard it went well
She did a
though.
wonderful job.
That's great. That's great. Well, today on the next slide, you'll see I'm going to go through three things. I'm going to talk about the on-demand interview pilot that we're going to be kicking off at the end of this month. I'm going to talk about the low-income home energy assistance program, the LAHEAP program. We built an application portal. They'd like to share that with you. And then our state medical eligibility unit does a bunch of disability determinations. So we've had some great success there too that I want to share with y'all. So on the next slide, I'll go ahead and get into it. So I think the last time I presented to y'all, I brought this topic up, the idea of an on-demand interview, but I'll give a quick overview again, just as a reminder. In the SNAP program currently, what we do, we have to do an interview with our clients before we can determine whether they're eligible. We do an interview once a year also to renew their benefits. And that interview takes place over the phone most of the time. And the way it works is we schedule a date and time with the client, and then we call them. We do an outbound call to the client, hope they answer. And if they do, we conduct the interview. If not, we sometimes end up going back and forth with them, trying to reschedule or find a time to talk to them. And that leads to some inefficiencies, that back and forth.
So
You have a question?
I just wanted to just ask you, so it is a personal interview. In other words,
Correct.
it's just not, hello, I'm John Q, and go through that. In other words, we actually have the sit down with them, and they bring documentation of what they need for.
Well, what they do is they'll submit it all in advance, and then we'll kind of queue it up and then go through it all with them
Okay.
during the interview process. Yeah, usually takes about between 30 and 45 minutes, depending on the size of the household and kind of the different kinds of income or whatever their situation may be. So we do talk to the head of household for every one of our SNAP families. And so again, right now we do an outbound call to them to make that, to complete that interview, or do an in-person interview in our office. But most of them are done over the phone. And, going back and forth with them to talk to them sometimes is challenging, getting in touch with them. So what we are proposing to do, or what we're going to test out in this pilot, is switching from an outbound call to a system where they make calls to us. So we receive inbound calls. And so very excited about that, but because clients can call us whenever they want, and we always have people available to take the interviews as the phone calls come in.
John, is this, do you schedule that outbound call, or is it a cold call, or how does that work?
So right now it's a scheduled outbound
Okay.
call, but what we want to move to is to where they just call us and we have people available to take their calls.
Okay.
Yeah.
What, is there a verification that you
Yeah.
use to verify that it's Scott, and he's calling in for
Yeah,
Scott's
yeah,
family?
and so, I'm gonna get to that in a little bit
Okay.
on a later
Alright.
slide, and maybe we
Yeah.
can go ahead and advance a little
Yeah.
bit.
Let's
with the
go ahead.
slides.
I'm
Yeah,
sorry.
yeah. No, it's okay, it's okay. I want y'all to ask
Yeah.
questions, so
Oh,
feel
yeah.
free to interrupt, but if I go through a couple
Yeah.
things that might answer something for you. So we're gonna do a pilot, like I was saying, about this, and we're gonna start with just applications, so we call them intakes. It's our word for it, and there are some folks, if you have absolutely no resources, we are required to expedite the process for you. So we have to complete, if someone were to submit an application for the SNAP program and they, really have nothing, no resources, we have to get a card in their hands with money on it for them to buy food within 7 days. And that is very challenging to do if you have to schedule an interview and complete the interview. So we really think those folks will benefit the most from this. And so we're going to start with those expedited applications. And if their application is only for SNAP, and if their application is only for SNAP and family Medicaid. So we're going to start with that subset of the population. Some folks will submit an application for food stamps, Medicaid, TANF, and finding a worker who can process a TANF application is more challenging. That program has a lot more involved in it. And so we're just going to start out with this subset of, I won't call them easy, but like maybe less complex situations. And so we'll start with that group of folks and see how it goes. We're going to run that for 4 weeks. If that's successful, we're going to expand it to our unexpedited, so the rest of the population submitting applications. And if that goes well, we're going to expand into renewals, so the interviews associated with the renewal. On the next slide, I've got a little more information about how this pilot's going to work. We're going to start the last week of this month, planning on going up to the Gwinnett County office and bringing a bunch of people in person to just do a little war room kind of setup and be able to watch the workers as they go through it and have support on hand for them in the first week. And so that'll be all handled through the gateway system and our phone platform. We use a vendor called Platform 28 to do that. So those two systems working together, will have about 300 caseworkers involved in the pilot in that first phase, and scale up as we go, and about 50 supervisors to assist them, and then a pretty good contingent of us from the state office too. On the next slide, I think I get into how this kind of works. So when someone submits an application, we've built into the system some configurable, a configurable setup so that we can expand the population that's under the on-demand process. So at the beginning, it'll just be set for applications, and it'll just be set for SNAP only and family Medicaid only applications, those combos. So the system will check if it falls into that criteria. If it does, when someone submits their application, we'll automatically generate a letter that we send to them, and we'll also send them a text message. It says, hey, when you're ready for your interview, call this number, and we will have a team of people waiting to call you. If they fall outside of that category, maybe they're in one of our ABD classes of assistance in Medicaid, the AIDS, blind, and disabled ones, we're going to exclude those at the beginning. Or if they submitted a TANF application, they would just get a regular scheduled SNAP interview. They wouldn't have the on-demand ones just for the pilot. And then on the next slide, say I were to get one of those text messages, I submitted my application, and then I get the text to call. I call into our main phone line. What will happen is the phone system will check using the phone number, or using the person will put in their client ID. And if they put in their client ID, and it matches up with what we have in the system is this person is eligible for an on-demand interview. It'll automatically route them to our on-demand interview team. If someone were to call in and they're not eligible, and there's a caseworker linked to their case, it will automatically send them to their assigned caseworker. That existed before and has always existed. And if there isn't a caseworker assigned to their case, it goes to our customer contact center, where we have a group of people that can answer questions. But so the system's set up to identify the people based upon the criteria we defined for the pilot. The phone system is set up to route people to the on-demand interview team, and hopefully that will work out, because I think it's going to be a better way for us to deliver or to complete that part of the process, that interview process. We waste a lot of time trying to get in contact with people, especially those expedited interviews. Scheduling this many interviews, you have to have people available, and you have to look at their calendars, and if you're out of the office, you have to block your calendar off so the system doesn't automatically schedule all these interviews and things like that. And we end up, if someone gets sick, we have to reassign all those, that day, and all of that will go away. All of that administrative piece will go away. I think on the next slide, I have a little bit more information about how it's going to work. There's two opportunities for us to get in contact, and you brought this up a little bit, I think, or you may have been hinting at this. So we will have a team of people just ready to accept these inbound calls. But if they're not busy, what they're going to do is make outbound calls to people, to cold call people. So if someone submits their application and they haven't done their interview yet, and we have capacity, we're going to call them. And we've talked to other states, and one of the states we talked to said they get 60% of their interviews done that way. We call it a first contact call, is what we're calling it, but cold calling clients, they were able to handle 60% of their interviews that way. Just reaching out to the clients and getting them and conducting the interview. So we do some cold calling in our work too, to try to handle those expedites when they come in within that time period. But this would be more, flex staff. So if we're busy, if we're busy with incoming calls, we can handle those. If there's a lull, we can reach out to folks and try to get the interviews done that way too. Yeah. And then on the next slide, talk about, so if somebody does not call us, so we will actually send them another reminder notice. And so it depends on kind of the time period assigned to that case. Like I was saying, some have to be done within 7 days and some we have 30 days for. And so for the 7-day ones, if they don't call within the first 5 days, we'll nudge them to call us again. And for the 30 days one, I think it's about 10 days. After 10 days, we'll be like, hey, you haven't called us yet. This is what you need to do to complete your interview.
So you're reaching out to them and prompting them to call in?
Correct.
Okay.
With texts,
Right.
if they have to opt into the text, but if they opt into text, if they have a phone that they can use, we can send them via email, and we can send them via paper mail as well.
These are the ones that have sent or applied,
Correct.
Right.
They submitted an application to
but
us.
they haven't followed through with anything else. And they just.
That's all they've done so far.
They just applied.
Right. And the next step is the interview.
Do they get any heads up preparation for the interview prior to the actual?
That's a good question. I
They
think
know what to expect.
the application process is pretty thorough.
Okay,
They're only required to submit their name and address and sign it and send it in, but we do, through Gateway, encourage them to complete the full application, and they kind of get a good understanding of all the questions we're going to ask if they go through the process.
have you ever used voice recognition to ensure that it is the client?
We're not using that yet.
Okay.
Our IVR system, I think, has a little bit of that in there, but we're always looking for ways to improve though.
Right.
So that's something we can look at.
This
too.
is for determination for SNAP, right?
Correct.
Eligibility determination. Is
Yeah.
it also for redetermination?
So that's kind of phase 3 of the
Okay,
pilot.
well,
So
let me get ahead of you.
no, it's okay. We're starting with just applications to see if it works.
Sure.
And if, like I'm calling it a pilot, so the first 4 weeks will be just expedited applications. If that's successful, the next 4 weeks will expand to all applications. If that's successful, we'll expand to all renewals, and we'll just keep going. And that's just how it'll be forever. We'll keep expanding until we've covered the whole base. If it doesn't work out, we can pause, or we can abandon the process too, and just go back to where we were before.
Okay, how do the kiosks help with this?
Good question. So we do have
Uh-huh.
kiosks in all of our lobbies. And
Mhm.
so really that would just be for the application submission process though. So the kiosks allow people to go into Gateway, put in their information. They can also upload additional, like, say we do the interview with you and we needed some additional verification of your income or a copy of your lease to verify your shelter deduction or something like that. You can submit those documents using the kiosk too. Yeah, that's a good question. Yeah, maybe next slide. Do I have any more on this? No, that was the end of the on-demand the slides associated with this, but I'm super excited about this. I know I already presented to you about this like 6 months ago, but it took us a little while to get federal approval. But we did shortly after the government shutdown ended, got approval to move forward with this. And it was right, we went right into Thanksgiving and then we had the holidays. So we've been doing what we can over the holidays to prepare. A lot of work this month to finish up the training, and we'll start at the end of this month.
You're starting into this month in Gwinnett County,
Correct.
and expand it based on what you learn from the pilot. Is that correct?
Yeah. If it's successful, we'll keep building. If we need to pause or adjust things, we can do that. It'll be pretty easy to make adjustments.
If it's successful, what is your estimate of us getting through all the counties? We got 159 of them.
Sure, it's actually we're just gonna be physically located in Gwinnett County, so the pilot will be statewide to begin with. It'll just be segmented to the application work stream. So we're actually starting statewide, but we're just gonna be, the Gwinnett County office is a good location. Yeah.
Let me ask you, is this an effort to address our error rate?
So this is more, I'll be honest, this is more targeted towards timeliness.
Yeah.
So there's kind of two metrics that we have. We have to complete, the applications within 7 days or 30 days.
Okay.
And we're required to be within 95% of them, or we
I
go
see.
under a corrective action plan with
I
our federal
see.
partners. So
Mhm.
this isn't specifically targeted at accuracy. I do think having better communication with our clients will improve our payment error rate better too. I think the efficiencies that we'll gain with this will free up, around like 25% more capacity. And we can use that capacity in other places. We lose so much time. I say 25%, who knows how much it really will, but I know my leaders spend a lot of time trying to make sure these interviews happen when they're on the scheduled date and time. So getting away from that just by itself is going to be such a huge gain for us that really, it's going to be good for the clients too, because they can call whenever it's convenient for them. But just for us, the administrative burden of that process, being able to have all those hours back of just like calling someone and then not answering, and then them calling back and leaving a voicemail, and then we call them back and they, people are so a lot of our clients do work. And so, them taking off the time and us connecting with them is challenging. So, I do think it'll help though. Sorry. Long answer.
Yeah, that's a good answer.
Any more questions about that though? I will report out, in the next meeting on how it's going
Good.
to
Oh, yeah,
give you guys an
good. Yeah.
update.
Very interesting.
Before I move on to this next one.
My only question, so with the process we have now in Gateway is performing its task that was designed to do, because we were here when it was all being designed. So, it's been updated, taken care of, and we don't have been able to catch any duplications or whatnot, various from the applicants.
Yeah, I think that, so the process works well in Gateway as is designed. It's just the connection piece with the clients is the challenge for us. And really, like, we've enhanced Gateway a number of times, like you said. We tried to make it so that when people apply, they can like pick a time that works for them when they do their application. Like, yeah, I'm usually free in the morning, and so we schedule their appointment in the morning. But even when we do that, it's just people don't answer the phone when you call them from a number they don't recognize. And we try to send text messages to people before. We're like, hey, I'm John, I'm from DFAX, I'm gonna call you, and they still don't answer. And then you leave them voicemail and they call you right back, but then now you've moved on to another call, and so you miss them. So it's really just the logistics of that. Like, Gateway is doing the current process well. It's just the current process a little inefficient. Did that answer your question? Okay, yeah.
One more question, related but not exactly. How often are we required, talking about our federal partners, to perform redetermination on SNAP?
That's a good question. So we have to contact our clients once every 6 months for most of the people. Our folks that have to do a work requirement, we have them set for every 4 months. So we check in with them every 4 months. We're only required to do an interview once a year. So at the 6 month point, we do what's called a periodic report, which is basically where we ask them if anything has changed in their circumstances. And they can say no, and we just authorize them for the next 6 months, or they can say yes and tell us what was wrong. And if we don't hear from them, their case is closed. So it's every 6 months, but we only have to speak with them every year, unless they're in one of the under that work requirement, which is every 4 months.
So at the end of the year, what happens? We just start over again, or what? Or you just
So you do an interview. So
go
after,
back to the interview process?
correct. So
So
once a
this-
year, we do this
So
whole
this is only
process.
for 12 months and then start over again?
Correct. So we do have to talk to them every 6 months, but we do have to communicate with them, but we only have to have an interview with them every once a year. They can just submit an electronic, nothing's changed with my case, or, I got a new job, here's my new income, or I moved, this is my new, or something like that. They can do that once every 6 months. If they have a substantial change in their circumstances at any time during the 6 month or 12 month period, they're required to tell us too, if it affects the budget. So, but our scheduled check-in points are every 4, 6, 12 months,
Okay.
depending on
Good
the
info. Thank you.
circumstances. Yeah. All right, I'm gonna try not to take more time than I always take too much time. So the next thing, they're like 15 minutes, Sean. So the next thing I'm gonna talk about is from LAHEAP, which I don't talk about very much with y'all, but I did want to highlight a success we've recently had. The Low Income Home Energy Assistance Program is, a lot of federal money is given to the states, and we pass that money on to community action agencies, which are local agencies that help people who need assistance paying their heating and cooling bills. So for some people, that is like life-saving aid. If you're elderly folks can't pay their heating bills, that can be a life-threatening situation for them. So
Give me an example of a local agency.
a local agency, you got me stumped there. But so there are 18 community action agencies spread out across the state, and I can get you a list of them. They're appointed by the governor, and they're nonprofits that work in the communities to engage in the application process with folks. So they're kind of the boots on the ground. They don't work for us, but we oversee their work through this system that's been set up in the LAHEAP program. So
Do the areas on aging come into that? I think they help with that,
yeah, there's a
Yeah,
connection
they
with the
take
aging
the-
community.
applications.
Yeah, there's
Mhm.
local nonprofits, and there's different one in every one of the little regions throughout the state, and I can get you a list and a map of them.
Right.
But like, the one in Macon is called like the Bibb County Community Action, or group, and so they work closely with us. We have a whole team of folks here that help oversee their work and stuff, and they will go out into the community and take applications on paper, is how it used to work. And they will then manually enter that into our accounting system, which, because the manual process can be error prone. And so what we did, and what I was going to highlight today, is that we built an online portal for them to do those applications in now. So they can take the community action agency folks will still do the process with the client, and they'll enter their information into the online portal that they have, and then that will go directly into our accounting system. So we don't have to, like we used to have to travel to their locations and actually look through all these paper applications to do audits and to oversee their work. But now we still go on location to do audits and stuff, but we can prepare in advance by going through all this stuff within within this new system. It gives us a lot more visibility into their work, and helps us oversee the use of those federal funds. And so I've got some information up here that talks about, our first year, over 110,000 of the applications went through that system. It was directly transferred to our accounting system, and removed a lot of that stuff. We were able to, there's emergency applications, kind of like SNAP, people who are in a dire need for support that have, I think, a 3-day turnaround time for those. And, we can help the agencies track those if we see ones that haven't been addressed and things like that.
That was part of that when y'all went out, when we went out into the field, and like when you came to Augusta, is that part of that program when you had the
Disaster SNAP?
the SNAP program at the school at that time?
No, that was the SNAP program. This one's a little bit different. This one,
Okay.
so that was food assistance, and this one is energy assistance. Yeah.
Yes, if you have a low income renter and the if utilities are included in the rent, can the landlord apply for assistance for the renter?
I don't know the answer to that question. I think that the way that it works is we work directly with the utility providers in a lot of instances.
Okay.
And so I can find out the answer to that.
Yeah.
Let you know. How
Because there are
that's
some
set.
situations like that.
I know, you're right.
Mhm.
And so that would be a good example of where, someone could need assistance with their overall rent.
Right.
It's a sub portion of that is to pay the utilities. That's a good question. But very excited about being able to, at least
I know this.
put some of it, take some of it off paper. It's really been really great. We worked with the CAAs throughout the process. They have a association that kind of organizes them, and we were able to work through the association to gather information, feedback from them and input from them as we were building it. And on the next slide, I think, hopefully in the future, we'll be able to put this this public portal, available to the public. So the public could apply online too. It's a little different because they're funding, each agency is given like a different amount of funding based upon the need in the area, and they manage that funding to make sure, they target people who are in high need and stuff like that. So we're working through some of those pieces on the best way to allow for a public facing application. But right now they're using it themselves to interview people, and we're working on, making it so that it can, right now they would have to have a computer and be connected to the internet. We're going to try to figure out a way so they can have it on like a tablet and be offline and fill out the applications with folks if they go out to an event and then come back and it'll upload and things like that. So it's been very successful so far, and looking forward to enhancing that a little bit more in the future. The next thing I want to talk about too, another success story, is another, probably kind of a niche thing in kind of all the work that we do. But for some classes of assistance in Medicaid, some subsections of the Medicaid program, you have to, a doctor has to determine that the individual is disabled before they can get that type of support. And so our requirement is to do those within 90 days. And a lot of the times the federal government was making that disability determination. Social Security Administration makes a lot of disability determinations for their benefit programs. And we were able to use that disability determination for this purpose as well. That policy changed. And so a large portion of the disability determinations shifted on to us to do. And the way we were doing that is we had contracts with doctors. We had 3 doctors at one point, and it went down to 2 doctors that would review these, packets of medical information about people and determine whether or not they were disabled from the information that they provided. And that takes a long time. Like our doctors were doing, 20, 30 a month total. And it started to get where we needed to be able to do thousands a year after this change. And so to handle that new workload, we contracted with 2 medical service providers. On the next slide, I think I have some statistics about this. Well, we contracted with 2 medical service providers because they have access to almost what feels like an endless supply of doctors. So instead of us trying to create direct relationships with individuals, we hired 2 companies to do that for us. So we can pull on, a much bigger pool of doctors, and they set that all up for us. We don't have to find them. On the next slide, you'll see some of the numbers I was talking about. In 2023, the whole year we did, 286. 2024, 230. And then in 2025, once we brought the service online, we were able to do almost 4,000. So, right immediately when the change happened, these started to kind of pile up a little bit because they were just overwhelming our doctors. But we were able to completely eliminate that backlog of cases to review. And now most of them are done within 30 days. So the only reason any of them go over 30 days now is because a little back and forth sometimes has to happen on some of the more complex cases. But we were able to go from, having a very large number that needed to work with some age on them to now they're done almost, they're done the same month they come in. So that's been a great success. We've been very happy about that. The providers that provide, because providers will provide services to these folks while their applications are pending. And having them resolved quicker, we're getting a lot of positive feedback from the provider community too. So it's been a great development, good success. Just wanted to share that with y'all.
No, I appreciate you.
Yeah.
I know we appreciate you.
Yeah. The last
Success there.
slide, it talks about, we're going to take those contracted doctors and now shift them to do quality control on our contracted or on these services. So we're going to have them review, maybe about 10% of the ones they do just to make sure that they're good. And some of my staff is watching this program and sent me a response to your question about LAHEAP while I've been waiting. So the landlord can apply for LAHEAP assistance when it's
That's
built
good
into
to
the
know.
rent.
Thank you so much.
Oh, wait, no, sorry. They restated the question. Can they? And they said, no, actually. They just said it completely backwards. This is what I'm trying to do it. I'm trying to do it live
Okay.
and I'm messing up here. So
All right.
it's a little more difficult for that one
All
when it's
right.
included in the rent. But the providers have to go to the money can't go to the landlord, it has to go to the utility company.
Okay.
Sorry, I said that backwards. Thank you, Ben, for watching this and providing that answer in real time.
Yeah.
Good stuff.
Sorry, yeah.
All right, the cost associated with all this, have you seen, as the federal, I know they had to shut down, but in the past 3 or 4 years, have we seen any major cutbacks in the feds supporting these programs because we're basically a pass-through? So
We are.
are we, and
For the LAHEAP program, we are, for sure.
are they making is it shortfall or what? I mean, have they cut back or anything, on the monetary part of that?
So in the LAHEAP program, we haven't seen that much of it. We do have some decrease in federal support coming up in federal fiscal year 27 for the SNAP program. So currently the federal government splits the administrative cost of the SNAP program with us 50-50. And that's going to change to 75-25 with the state covering 75%.
So the SNAP program now, we got up to 75% and they got 25.
Right now it's 50-50.
Right.
And it's going to change to 75-25 with the state at the 75% mark.
We've got to pick up 75%.
That's the administrative costs.
Administrative costs, correct. So that's a big upcoming change for that one.
But the benefit has not been changed.
So the benefit amount currently is covered at 100%. And the federal government will continue to cover the benefit amount at 100% depending on our payment error rate. And so like in a year.
Repeat that, you're based on.
Sure,
what?
sure. Yeah. That's a complicated topic. So the current benefit amount is covered by the federal government at 100%. And we push out $3.2 billion in the SNAP program per year. So it's a lot of money. And starting in 2027, the federal government may continue to cover the benefit amount at 100% if our payment error rate is below 6%. If it's above, I think it's 6 to 8, the state will pay 5%. If it's 8 to 10, the state pays I should get you the exact numbers on this. I'll send you something after this that gives you the breakdown, but it's a sliding scale between 5 and 15% will have to be paid by the state if this payment error rate's above 6%. Yeah, so that for us, 15% is of $3.2 million is 500,000 or $500 million. So that would be a big change if that were to happen in Georgia. But it hasn't gone into effect yet. So we still have time to get our payment error rate in a position where we would not have to pay.
But for the last 3 or 4 years, we've met our goal as far as the error rate goes.
We have not.
We have not.
No, we have not. So we would be on the hook for 15% of the benefit amount if our payment error rate did not.
That's over the last 3 years.
So I think one of the years we would be in a different category, but the last year would be 15%.
And that's part of the beautiful bill. I mean, that's.
It is.
Yeah.
Is the error rate something we can fix?
We are working very aggressively to improve our payment error rate. Yeah, and so it's really, so the SNAP program is not like, you don't get SNAP or you don't get SNAP. It's not like Medicaid where you're either getting health care coverage or not. It's a spectrum. So there's a maximum allotment that you can receive based upon the size of your household. But if you have income, whether that's earned income, like wages and salary, or unearned income, maybe that, unemployment or child support or something like that, it's a spectrum. So, or it's a budget. And so if you have some income, you may get less money than someone of a similar household that has no income. And so if we, like I was saying, if we don't do those shelter deductions correctly, you can get deductions for medical expenses too. If we calculate those incorrectly, the dollar amount we're off by counts again. We do a random sampling of some cases, and if we do those cases incorrectly, the amount of money we were wrong by compared to the total benefit amount issued is our payment error rate. And so it's either an underpayment or an overpayment amount. And so that's how it's calculated. And maybe that could be a whole presentation I could give on how payment error rate works and how it's calculated. And I can go through all the things we're doing to improve that too. We're doing a lot. Because with all these changes, we've been really focused on timeliness over the last couple of years because coming out of the pandemic, just real hard time, or we had to recover a lot staffing wise, and to do that was a big effort. And really, it's just a lot of focus on getting work done. And now that we've caught up and we're in a better place from a timeliness perspective, now it's don't just do the work, do it more accurately. So that's where we're shifting our focus, or we have already shifted our focus. I've got a lot of good things in the works to improve that within the time period that we have built into the bill. So I think that we'll be okay.
So is there a time frame? And I know the last error rate we received is 2024, right? Is that correct? For 2020, we don't.
So
have
it's done
2025's
monthly,
error rate.
and so it's done monthly, but the calculation for the match rate is done annually.
Okay.
Yeah, so we are, and it lags by 6 months too.
Yeah.
So we'll make an eligibility determination, and then we'll pull a sample, and then we have what we call a quality control team that our folks actually do the investigation and report the findings up to the federal government. And they're like a separate segment. I'm not allowed to influence them or anything. They're like protected people and everything. So we don't try to game the system or anything, but they tell me at the same time they tell the federal government. So I find out usually about 6 months afterwards. And so I think I just got the August numbers. So I'll get the September numbers pretty soon. And so that'll be the end of federal fiscal year 25.
So you get results monthly, but what we're on the hook for, so to speak, is an annual rate. Is that
Correct.
Understand that correctly?
Correct. I think we're around 13% right now.
But with those monthly reports, do we see a guide of which way or?
So it's pretty
the
inconsistent.
shortfall or
I'll
what?
tell you, it's pretty inconsistent.
I know it's got to be
Yeah.
complicated, but you could see a trend of what we, at the end of what's going to
Sure.
bite
So
us.
Yeah, no, that's good. We can see the areas that need improvement. And you can kind of, the percentage varies a lot throughout the month. One of the things we're doing to improve our payment error rate, or one of the things we're trying to do, is submit a new sampling methodology to the federal government, because right now every month we pull about 100 cases out of the total population. So we have about 770, it's between 700 and 800,000 families on SNAP. And if you just randomly grab 100 of them from the whole state, that's not really representative
No.
of, and so we have we have designed a new plan that we think maybe get a more representative picture of the work we're doing across the whole state that is currently been submitted, or it's been submitted to FNS and they're reviewing it.
What size sampling do you think would be appropriate?
Well, so because of the amount of work it takes, say I did an interview for Scott, and we did an eligibility determination for him, and I'm the caseworker. I have this 45-minute, like Scott submitted an application, provided all his information and documentation. I spend 45 minutes on the phone with Scott, going through all his stuff, confirming it's accurate, making sure he's aware of all the rules and stuff with SNAP. And then it gets pulled in a sample, and Monica over here is going to be my QC person. She goes through that same process and re-verifies everything. So the case I spent an hour on, Monica's going to spend 1 to 2 days on, going back through, recontacting the client, redoing the interview, making them verify every data point that's in that case. And so there's some things that we could accept client statement for. She cannot accept client statement. She's going to go and get proof of every single thing. And so we honestly couldn't do enough to get a statistically significant sample, just because of how the man hours it would take to do that with a population as big as ours. But some of the proposals that we're looking to do is limit it, instead of being the whole population, shrink that down to the month in question, actions that took place in that month. Because right now it could just be any case, anything happened at any time. So shrink it down to just the actions that took place in that month. And then also try to make sure it's geographically diverse. So, if you grab 100 cases from a sample size, like from the whole state of Georgia, the chances of those all being in a metro area are pretty high, because that's where most of the people are. Try to spread that out and get a more, a better picture of our work across the state. So
we're,
hopefully that gives us a little more good look into what we've done that month. So if I make an improvement this month, when we pull the sample for this month, we'll be looking at the work that was done from that month, and it'll be a better reflection of what we're doing at the time.
so we, for FNS, we sample through focusing in on 100 out of 770,000 in a month, right?
Correct. So we pull 100 a month, and we do a sample and
Random.
send the results off. Yep.
Okay.
So it's challenging, because if you get, for example,
Small
like
sample,
if say I approved a case for a family of 5, and it was like $1,200 benefit, and they were actually not eligible, that's a $1,200 hit. And so say the total sample is, like $10,000, my payment error rate's already 12% just on that one case. And so it's tough when, it's like if the total benefit amount is an error, that's really hits us hard. But usually it's smaller things, like medical deductions are complicated. People will, we have like utility allowances and things like that, where it'll be a situation like you were talking about, where they'll claim a utility cost, but it's actually part of their rent. But they just didn't understand. Like, not all of it's malice. It's like, people are like, oh, this is how much heating and air costs, and this is my rent. And they think of those as 2 things instead of 1. Or like, a lot of people don't think about child support as being income when it is counted as income, and things like that. So it's not always fraud. It's, people just not understanding the rules. And we try to coach interviewing skills about, like, ask the same question a couple different ways. So when you say, hey, do you have any income? People think, oh, I don't have a job. No, I don't have any income. But if you follow up and you're like, oh, well, you receive unemployment from a previous job? Oh, yeah, well, I do get unemployment. And so like, if you just said you have any income, they might not include those other pieces. So it's challenging because you have to have very well-trained staff to do really good interviews to prevent that kind of errors that would be found in a more thorough review that's done by, so I keep pointing at you, my QC person, my hypothetical QC reviewer.
Yeah, so training those folks that do those in-depth interviews is key part.
It is, yeah.
Thank you for taking, and it's an extraordinary amount of time that but this is something we gotta fix for Georgia.
For sure.
Our state budget is gonna be paying the price, right?
Yeah, and we actually have some time. I think the way that our payment error rate is looking, they built in a provision of the bill. If your payment error rate is high, they're gonna give us an extra year to correct it.
Mhm.
So because of our current, it's not finalized yet, I don't have September, but because of the trajectory we're on right now, I think we'll be above the amount that will push us into the effective date not being until 2028. So we'll have another year to work on improvements, and this will be my next presentation. Yeah, we have like a couple working groups working on some stuff. We have some technology stuff. We've got a couple things submitted to FNS with their sampling plan and some waivers that we hope will turn us around. So I think we have a good approach or good plan moving forward, working towards securing some resources to help.
So in an upcoming meeting, whether that's the next board meeting or another meeting, can you inform us on specifically what actions are being taken to improve our error rate? And I'll ask the commissioner the same thing.
No, we can do that. I think she's here with us today now. But yeah, the legislature's asked us the same things. I've been pulling all that stuff together, so we can definitely.
One final thing, and I guess we'll let you go. As perilous as this is, we know we don't rank well by comparison to other states. In education policy, I'm always looking, which I've done a little bit of, always looking at what other states are doing that are performing better than we are in Georgia to look at what they're doing well and seeing if we can learn something from that.
Mm-hmm.
Is that process occurring here?
It is. So, we talk to other states all the time, and FNS actually facilitates a lot of sharing of best practices from other states too. And to be honest, I know the on-demand piece is not directly targeted at payment error rate, but I honestly think the capacity will gain once we lose that administrative burden of just, we waste a lot of time. Like, I honestly think it's like 25% of our time is just chasing clients. And so if we're able to get away from that, I'll have so much more capacity to focus on, when I am talking to the person, like something I'm pushing out, or I've been trying to teach over the past year in conjunction with the on-demand interview is first contact resolution, which is a way to say, I only want to talk to this person one time. So while you're talking to them, instead of being focused on getting 20 cases a day done, get 10 cases a day done right. Like, take the time. Like, if they don't have a piece of verification, maybe you can make a call with them right now to get that piece of verification. Maybe you can work with them to tell them how to upload their lease take a picture of it and upload it into Gateway. Take the time to work with them to get it done and to get, I think doing those things, like slowing down to speed up, is what people say, right? It's like doing a lot of that work will really, have a lot of long-term benefits. And we started doing a lot of that stuff when we were focused on timeliness, like getting out of a situation where we had, a lot of work and not enough people to do it. Now that we're out of that, we've already started doing a lot of things to improve customer service. And the things we're doing to improve customer service also will help with quality. So it just takes a long time. Really the thing that would help me the most is to have 500 more workers that have worked here for 5 years, because it just, the complexity of the program, it just takes a while to train a person and to build that skill set up over time. But we're doing, I think we've presented to y'all before some of the retention stuff we've been doing, some of the hiring stuff we've been doing. A lot of that's been really successful, and it's just continuing to build on that And, you know, we've been lucky to have the support of state leadership to get the resources we need to continue.
As far as what's the training, then how good are we at retaining and once we train them, how good are we retaining the changeover?
Yeah, retention has improved, and we can provide you our human resources group does a good job tracking that year over year. It was pretty, you know, during the Great Recession times was pretty bad.
Yeah.
But we've seen a turnaround. You know, people want to stick around. We've been able to offer people raises. We've been able to doing a lot of stuff to make supervision a little bit better and, you know, offer the support that people need to be successful. So we have seen that turn around in a pretty good way, and they're able to keep people around. So it's been those things. I think the biggest successes of my tenure here, you know, it's been almost 3 years now, it's been hiring a lot more people, keeping those people around, and then using those resources to reduce backlogs. And now that we're in a place where we have a workforce, it's seeming to stabilize. We're able to keep people for longer and keep people who have been here. Now let's focus on what can we do to get back to the last piece is the payment error piece. You know, what can we do instead of doing a lot of work? We want to do a lot of work and do it right. So, you know, I feel like it's all building for me, from my perspective, and we're just having continual improvements and things like that. So I'm very optimistic. I think that my team is very strong, and we have been heading the right direction the whole time. So it's just the next thing, and I think we'll be able to do it.
Very good.
Any other questions for John or anyone on, any board member that's with us online? Any other questions for John or the Office of Family Independence?
Thank you.
Thank you.
Yeah.
Thank you, John.
All right, the Office of Child Welfare. Welfare. Lon Roberts.
Yes, sir. Good to be with you.
Good to have you with us.
Happy New Year, everybody.
Happy New Year.
It's always good to follow John. He does such a good job, but we try to collaborate. We were talking yesterday, and so my presentation is much shorter to keep things moving.
You think?
We planned that out, so
Right.
not really, but I told John yesterday in private, and I want to say in public as well, I'm really impressed by his innovation. His team's always innovating and looking forward, and it's real impressive. So I commended him, and never saying what in private what you wouldn't say in public. I told him in private, I'll say in public as well. I think his innovation and just drive to what's possible and try different things is really inspiring. So I appreciate his team and his support that you provide his team. As we know, the last couple of months have been among the best months of the year, and now we're in the new year. And so I want to take us back into November, December, the good warmth feeling we had, and look at a couple of high-level events, recognitions we had, and then we'll kind of begin to paint a little bit of what the future may look like. But we know in November is National Adoption Month. When children can't stay with their birth families or be reunified with their birth families, we want them to have a forever family through adoption. And so that's when we celebrate those adoption caregivers who step up in November. We do it all year long, but it's formalized in November, and the governor had a proclamation recognizing the month in Georgia. The president did as well. And so in November, we had 109 adoptions that were finalized in Georgia. We had a total of 1,170 adoptions finalized in the state fiscal year 2025. And so it's really,
How many 2020?
I'm sorry, 1,170.
Okay, thank you.
Yes, sir. And it's, again, it's really a beautiful thing. You think of opening your home up and providing that forever family to children. And so we just want to commend them in November again and throughout the entire year. We'll take a moment, though, just to plug. We still have right now 402 children eligible for adoption who don't have an identified resource. So we're still trying to find families, forever families for these children. And anyone who's listening on the call, certainly on our DHS DFACS website, there's an adoption page. I encourage you to visit that and step up if you're interested, because it's really a beautiful gift, providing a forever family, forever home for children in need. We also had Clark's Christmas Kids. That's the 35th anniversary of Clark's Christmas Kids. I believe you were a part of that this year as well. Thank you for that. And when we provided and we're able to have 27,000 gifts were collected. Over 9,300 children and youth in care received 3 or more gifts on Christmas morning through Clark's Christmas Kids. That is beautiful. There is a Santa Claus. It really is, and I think that's a beautiful example of the spirit of Christmas and the spirit of Santa Claus. And want to thank Lamar Ivory, who's sitting behind me, and her team who kind of run the groundwork on that. All the volunteers who donated, all the in-person time, just a beautiful event. One thing we always look forward to every year. So thank you for that. So that was some good warm events. We always like to end the year positively. Going into the new calendar year, the second half of the fiscal year, we have the Child and Family Services Review, which is a federal review of safety, permanence, and well-being, the key child welfare outcomes. And if you don't, and no states ever passed, and the federal government's recognized that, no states ever passed the CFSR. So they're looking to when you don't pass, you have to do a performance improvement plan, a PIP. And so the federal government's looking at a new pilot program that's not as complex as the old one, that's really rooted more in efforts around prevention, expanding foster home capacity to make sure someone to prevent children from coming into care. If they do come into care, there's a home for every child. And then improving permanency outcomes, which would be getting children back home or into adoption. A new pilot's coming. There's a call. I'm hesitant to even bring this up because I don't know a whole lot about it. It's a call with the Department of Health and Human Services Assistant Secretary Alex Adams this week to get more information about that PIP process. So we'll share more as we learn more. But I also to share that with you as a new innovative approach. I think after a while, the federal government has realized, though well-intended, the PIP process and the CFSR process has not resulted in the change I'd like to see. And this new innovative process should be something I think that's more targeted. But again, we have to build out the metrics for it. So there'll be a whole lot to learn, but I just want to plant that seed with you, and then we'll certainly cover more of that as we learn more. And we'll learn more as early as later this week. So I'll keep you posted on that. Very exciting, though, because I think it's been kind of stagnant over the years. And also making plans to recognize in February, Parent Leadership Month, where you celebrate parents, power parents. So that's kind of early in the planning for we want to always celebrate and support our parents, recognize parents. And then, of course, we have National Social Work Month in March. So some upcoming events we'll have and recognitions we'll have. That's all I have today. If you have more topics, like you mentioned, John, you want me to cover, certainly let me know or let Emma know, and we would be glad to bring you a targeted presentation. If you'd like some more data in the future, whatever you need, we're here to provide it to you. Just let us know and we'll get that presentation for you.
Okay, great. Thank you for your presentation and the work that you and you all in your department do at the Office of Child Welfare. Emma, thank you. Emma Lowe, thank you for letting us know about and I wasn't able to take part in Clark's Christmas Kids on that Sunday at Walmart in Marietta. I'm glad to know that because we were that day and was getting close to the end, we were way short. I think we're about 3,000 kids short of, or about somewhere around 9,000 or 10,000 gifts for 3,000 and some kids.
Yeah,
And so thanks for everyone in this department and thanks Clark Howard. I want to say
right
to Georgia, thank you, Clark Howard,
exactly
for treating our kids the best because they are our kids.
exactly.
So thank you.
Thank you, sir.
And we'll say something about that later. But again, thank you.
Thank you very much. Any requests, let Emma know and we'll get what you need.
Okay.
Thank you very much.
Report from the Department of Aging Services. Mayor Lee, right, we're glad to have you
Hello. Grab another
join us for
chair
the board
for my
meeting and
colleague here.
present us today.
We're glad to be here. Happy New Year. All right. Good to see you.
Good to see you.
Hope Randy's doing okay. We miss him, but thank you for being here. And for those of you who are online, I think you know I'm Mary Lee Boatwright Quinn. I'm the Assistant Deputy Commissioner of the Division of Aging Services. And today I want to focus on the study that we had done with the University of North Georgia. I've teased it a little bit here and there with some data and some maps in previous meetings, but we finally have our final report. We have a lot of other special projects going on to improve the quality of our services across aging as our population in Georgia ages. But we're going to focus on the UNG study today. And as part of that, I invited my colleague, David Watkins. He is our caregiver specialist, and he works on our Livable Communities team. And David and I worked closely with the UNG team on this study. We've contracted with them on, and it's been a great partnership because I have a very much 100,000-foot view of things, kind of a broader view. And as David likes to say, he likes to get into the weeds. He's a data research geek. So it was perfect, and I'm so grateful to have people like him on my team. So, welcome, David. Before we get started on the study results, though, I wanted to share also some good news from our gift drive, if you will call it that. For the Light Up the Holidays, all of our wish lists for Light Up the Holidays were fulfilled. It took us a little bit longer than usual, but we were able to, with the help of many generous donors, as well as I want to do a shout out to Jennifer Hogan Rivera. She's my team member who leads that effort and does all the coordinating. She also works in David's section. And it's quite an undertaking, but in 2025, we fulfilled 455 wish lists. 777 items were purchased from the Amazon wish list by over 100 donors. And the Amazon wish list fulfilled 160 of those wish lists. And then the remaining 295 were fulfilled by individual sponsors or groups like church groups or civic groups. So we're so grateful for that.
I'm gonna ask you just kind of an off the wall question here, but it was pretty easy to see at Walmart in December what kids want. And then we
Yes.
probably all know if we got children or grandchildren, that's bicycles and you know, tablets.
Technology,
A
devices.
big thing.
Yes.
It's typical.
That's a
Just kinda
great
give me an
que-
idea of a typical gift for that you all.
No, one of us,
Yeah.
somebody like me, okay?
Yeah.
Well, that's a really
I'm
great,
getting there.
a great question. And I actually posted this exactly on my LinkedIn when I was trying to get people to fulfill wishes, because when you think about it, these are folks under DHS guardianship. So they do not have typically family or friends that are supporting them. And so their wish lists are what we would consider necessities. We're buying a lot of soap. We're buying a lot of underwear and socks, which actually is something that my kids get every year. So, but a lot of those are on the wish list. Pajamas is a big one. So those are really, it's interesting to look at the list. It's a very different list from an adult is, more of the necessities.
Necessity items. Do they get to submit the requests?
They do.
Okay.
Those
like
are wish
this.
lists that they work on with their case managers. And not all of them submit lists. Some of them do have folks who are in their lives. So as I said, there were 455, and we have about 1,600 people who are under DHS guardianship. So, but we offer it to all of them. So thank you if you supported the drive. Anybody listening, we really appreciate the support. And we were grateful to light up the holidays for those folks. All right, so we're gonna get on to the RespiCare study. So we partnered with the University of North Georgia's Institute for Healthy Aging, and we're really excited to share with you some of the highlights of that study. It really provided us some insight into our data that we don't typically get because they do such a deeper dive into it. But in that, they gave us a lot of great ideas for the future and best practices and some quality improvement projects that we can do. So I think this study is going to inform us for years to come, and I'm really excited about that. And I'm excited to tell you, I mentioned to you all that we just picked up the final copy yesterday, and so I have copies for all of you to take home with you today. So it's a 90-page report, so heavy reading for you. But But if you'll go to the next slide, I want to make sure that everybody understands what respite is and the importance of informal caregivers. As you know, our mission is to keep people at home for as long as possible and hopefully through the entirety of their life, if that's their wish, right? But to do that, caregivers are such an integral part of that. They're the backbone of being able to allow somebody who is losing some of their abilities to do activities of daily living to be able to stay at home. And respite provides a temporary relief for those caregivers. It offers them a short-term substitute for the care that they're providing so that they can step away to rest or take care of personal matters, run errands. If you've ever been a caregiver, you know that it's sometimes hard to do those things. So even a couple of hours in a day can be super helpful to a caregiver. So, and it helps prevent caregiver burnout. And in the long run, it's helping us keep people at home for a longer amount of time. So that is what respite is. And we contracted with UNG to really look at our respite landscape across the state and as well look at our data to see how well we were doing with our respite care services and our other supports for caregivers. So this is a great photo of the UNG team. This is in December when we reviewed the final draft with them. Dr. Pamela Elfenbein is in the middle there, and she was the principal investigator and lead team member. So if you go to the next slide, I'm not going to go into a lot of detail here, but I wanted to just give you a sense of how complicated our data can be and how much work David had to do to kind of explain everything to them. It took a while to go through this process because we provide so many different types of services, and those are listed on the right-hand side. And then on the left-hand side is kind of how they decided to group them together. And really what I wanted to point out here is that if you look towards the bottom in the peach and the gray, they had to even come up with the acronym so that they could fit it all in their spreadsheets. But it's respite in-home care and then respite out-of-home care were the two most highly used and highly funded categories that they looked at. And for an example, respite out-of-home care would be something like an adult daycare where somebody would take their loved one for multiple days a week for a longer respite or to continue working, for example. And then if you'll go to the next slide, I also just at least wanted to give you the landscape of how much funding we receive for caregiver services. And caregiver services are what we call Title IIIe services. And when you look at this spread, and I know it's hard to see, this is our allocation spread across our 12 AAAs for state fiscal year 24. And that was the year they focused on 2018 to 2024, but they did a deeper examination into 2024. You'll see that the very dark blue line is Title IIIe caregiver services. So it's that tiny little sliver in the middle. And in state fiscal year 2024, that total allocation out to all 12 of our AAAs was $3.7 million. And that included federal, state, and local dollars. And then state funding for respite was about $1.3 million. So that's all inclusive out to the AAAs. Now, mind you, they can use some of their home and community-based services state dollars that don't have, qualifications to the dollars. They could use them on caregiver services, but those are most often used on funding for meals and in-home services, not for caregiver respite. So this has given us really also some insight into how we want to see funds spent going forward as we focus in our next state plan on caregiver services. And you'll see that there's a reason why we want to do that when you see the return on investment that the study showed us. So if you'll go to the next slide. wanted to share some demographics with you, and I'm gonna let David do that.
Thanks, Mary Lee. So some basic numbers, and for context regarding the priority of serving caregivers, AARP in their report Caregiving in the U.S. 2025 says that 24% of adults in Georgia, that's approximately 2.5 million people, are family caregivers. Family caregivers provide largely unpaid and unsupported care to older parents, spouses, and other loved ones. I myself have been a primary caregiver twice in my life. According to the Governor's Office of Budget and Planning, Georgia's over the age of 60 represent 18% of Georgia's total population, and that percentage is growing at a faster rate than the population of Georgia as a whole. So by 2034, adults age 60 and over expect to reach over 3 million people in Georgia. That's approximately 20% of Georgia's total population. Next slide, please. So I basically handled the contract with University of North Georgia and some of these deliverables. This is a condensed version, but we were looking for policies, programs, and best practices that we can implement to help serve caregivers more effectively. We want to analyze our Older Americans Act and state-funded caregiver services return on investment. The Older Americans Act's the 3E money that Mary Lee was mentioning. And then they are gonna present the data analysis and research and discussion in a white paper. And so today, a few slides we'll just give some high-level things we've learned from the study. And then after the presentation, we have the white paper for you. Next slide, please. So this was the data set that we gave University of North Georgia required de-identifying client residency for HIPAA privacy purposes. So we just drilled down to a 3-digit zip code so that we didn't want to accidentally share any protected health information that way. And you can see on the map, the left map is the total numbers of the population age 60 and over. You can see that's concentrated in the Atlanta region and down the Savannah region, okay? But the map on the right is the percentage of population age 60 and over that live in those regions. And that's more concentrated in our rural areas. The Georgia mountains, northeast, middle, and far southwest corner down by Albany. So we're all familiar with the challenges of rural healthcare and difficulties getting healthcare out there. This graphic kind of highlights the importance of bolstering support for caregivers in those rural regions, especially going into the future. Next slide, please. So this slide represents the assessment of the care receivers. That's who the caregivers are caring for. At the division, we use the DON-R throughout Georgia, which is basically an assessment of ADLs and IADLs. You may have heard those terms before. ADLs are everyday living tasks: eating, dressing, bathing, grooming, transferring, that sort of thing. IADLs are more complex life functions like managing money, telephone, preparing meals, laundry, housework, require a little higher level cognitive abilities. And what this shows here is, so the red line in the middle is a score of 15 plus 1 on the DON-R, and that is eligibility for nursing home care. So you can see our almost entire population is above that line, okay? So, and the scores of the highest 40%, so that's 60 percentile and above, are actually almost double the minimum amount for nursing home care. So what that means in essence is that our family caregivers are caring for people with high acuity whose needs far exceed the level required for nursing home placement. And that's who we're trying to keep in their home, in the community, and ultimately that equates to dollars saved for the state. Next slide, please. and dollars saved is kind of what return on investment is about. So when we consider altogether the federal and state graded and blended fund sources that we spent on the range of service activities for caregivers, the ROI calculation in the study shows that services administered by DAS do make efficient use of federal and state funds to keep people at home and in their community, which means we're also keeping them out of the long-term services and support system paid by Medicaid. So that's really one of the purposes of Division of Aging, is to keep folks home and community-based services, keep them at home, help the caregivers care for them for as long as possible. I'll turn it back over to Mary Lee.
Thank you. So as you heard, I mean, really, there were so many, and this is just a summary of the conclusions, but really they imparted to us that we are taking care of the right people in the right place at the right time, which is really essential to maximizing funds, both state and federal, and supporting, helping people stay in the community. And one of the parts of the study, and you see here on the right, is like a Wordle where they put the words that were said the most. Part of the study, they actually interviewed 90 caregivers, and those caregivers were all referred by our area agencies on aging. And they interviewed them about a number of things, but the words that you see on the side were the ones that came up the most. So need, help, care, support, resource. And one of the biggest things we learned from that, and we had some idea of this, is that people often wish they found out about us sooner, right? Wish that we had found out about you. So how do we reach them? How do we help folks? What we find is, especially in rural areas, a lot of caregivers don't identify as caregivers. They're just doing the job that their spouse who committed to till death do us part. They don't see it as a caregiver. So when we are reaching out saying we have caregiver supports, they're not connecting that to being themselves. So they gave us some great ideas about aligning some things on our websites with the AAAs and some other great best practices to just help better reach the folks who need us, because we see how effective the services can be. So that is something that we're taking into account and really trying to make some changes. As well, as I've said to you multiple times, we're going to ensure that we have a focus on caregivers, a really strong focus on caregivers in our next state plan on aging. And as we engage for feedback on our next state plan on aging, we want to make sure that we have caregivers feedback into that as well. So those were some of the main conclusions. Again, you're going to have the study to see the broader recommendations, because they had recommendations around technology, even AI coming in the future, those type of things that we're not going to get into detail on now. But again, they recommended strengthening the caregiver navigation and access to services. And if you'll go to the next slide, I have the list of just highlighting some of the recommendations. Expanding respite services for underserved populations like those in Georgia's most rural regions, where we saw that those scores, when you put those scores on a map, the ones with the highest acuity are down there in the southern Georgia area, the most rural area. So our caregivers down there are taking care of, again, people who are eligible, way beyond eligible for nursing home level of care. And then they gave us some ideas on enhancing our data collection and our measurement tools so that we can more easily show the ROI of these services. So we're already talking about the changes to make on that. And even working with our technology provider as well on that. So, and we actually presented on this study in August, and our national partners have said they want to see the white paper, and they also see the need for kind of aligning the measurement of ROI of these services across all 50 states, so that we can actually also compare apples to apples across our states. So that was exciting as well. And then they did mention, of course, that workforce shortages especially in our rural areas, of the caregivers that would provide the respite is a challenge for us and for the providers in those areas. That is not something that we directly do in our division, but there are ways that we can support the workforce through our AAAs and bolstering the provider network. So we have that in mind as well.
Where does the personnel come? Is that, they don't work for us?
No,
They
They-
work, how does that work? How does the service provided through our vendor or what?
Yes.
What? Okay.
yes,
Is there
Mr. Barbie.
chosen-
So we get federal dollars down to us, and then we allocate those out to the area agencies on aging. And then the area agencies on aging contract with providers of those services. And then, of course, it's the providers who are employing the caregivers. So so it is, down a few layers, but there are certainly ways that the AAAs can ensure, that they're maybe contracting with multiple providers. If a provider can't cover a certain county, they need to ensure that they've got like a redundancy of providers. And so that's been challenging post-COVID, but we're starting to see it come back. When you think that we see that they are adding additional providers and not focusing just on one.
What federal passes down to us, does that pass through to the excuse me, to the AAA agencies?
Yes.
100% down through them. In other words,
Well, there's always an administrative percentage, very small. You can see if you go back to this
Yeah, there's
slide,
a
this will
funding
show you
formula.
how the funds are allocated out to the AAAs. And as David said, we use something that has to be approved by the feds. It's called our interstate funding formula. Yeah, thank you. Slide 6. Thank you. This tells you the allocation.
Do these caregivers, and this study shows there's a great opportunity for jobs for caregivers. But
Absolutely.
are they like part-time or are they all like full-time?
I think it varies.
Varies?
It varies
Okay.
around the state and how they employ them. I think that it's primarily full-time, but I
Okay.
imagine that some of them have some part-time workers in their pool.
You see.
I mean, this has been on the radar of, there's been, the legislature has had healthcare workforce committees, special committees, and
Okay.
they're talking about this along with the nursing, the need for recruiting more nurses, and all of that kind of all fits in the same.
has there been a general increase in funds from the federal government for the, say, last 3 years, 4 years, or 3 or 4 years? Or has it just been
It's held
flatline?
pretty steady, I would
Yeah,
say, the
actually,
3E.
The
It's
3E,
X
the
and
last
that's
2
it.
years has been the same, and I think it's actually the same back about 4 years. We haven't had an increase in it. There seems to be more of a focus, at least in some of the discussion, so eventually you think that maybe the funding would follow, that it would increase. But like I said, there is opportunity within our home and community-based services state funds for the AAAs to have the flexibility to use more of those dollars on caregiver supports, because we have more flexibility in our state funds than we do in our federal funds. Any other questions? And like I said, I've got these in a box for you all. I'm excited to provide that. And for those of you who are online, we'll find a way to get it to you.
Thank you.
Well, I love a white paper, so thank you for, thank you for sharing that with us.
Yeah,
Any other
we
questions?
Yeah.
Or any other questions for anyone that,
Yeah.
any board members that are joining us online? Don't hear any. Thank you, Mary Lee. Thank you, David.
Thank you.
Thank you both.
Thanks so much.
I think that money we spend on things like respite here is money well spent.
Yes.
If you've been a caregiver, as I have, and many of us have, if that home caregiving has transferred ultimately into a residential caregiving, it's minuscule by comparison with the dollars
Right.
that are something like respite care costs, which is a lifesaver, as compared to residential care. Because it's crazy expensive. All right, next up, we're gonna hear from the Division of Child Support Services.
Good afternoon. Thanks for having me. So my name is Sarah Hurst. I serve as the Assistant Deputy Commissioner for Child Support Services. And today I am bringing you all some updates on our federal fiscal year 2025 performance outcomes, as well as a couple other program updates. So I think if we move one more slide, you all will see a snapshot of our year-end performance for federal fiscal year 25. And that covered the period of October 1st, 2024 through September 30th, 2025. We have a comparison, a 3-year comparison showing not only the 25 data, but also looking back at 24 and 23 as well. So I'll just kind of walk through each performance measure listed on the screen. So starting with current support, this performance measure is calculated by taking the amount of current support collected throughout the year and then dividing that by the total amount of current support that was due during the year. And I'm pleased to report we did have an increase in our performance for this measure. We increased by 0.89% compared to our 2024 data. And we also ended 2025 with the highest current support performance seen in over a decade, excluding the 2 pandemic years, 2020, 2021, when we had kind of some unusually high collections due to some additional payment sources that happened during the pandemic. So we were really excited about that result. Moving to our arrears performance, we calculate that by taking the number of cases paying towards arrears and dividing that by the number of cases that have arrears due. We also had an increase here by 0.33% compared to 2024. And then support order performance, we determine that by looking at the number of total cases we have that have an order and dividing that by our total caseload count, our total number of cases. And we also had an increase here of 0.87%. And we were really excited about our support order performance. We ended 2025 with a record high in support order performance since at least 2003. So we were really pleased with that outcome and really proud of our team's results there. Now you'll notice our paternity is the one measure here that you will see a decline. We did have a decrease by 1.12%. And paternity performance is determined by taking looking at the total number of children who were born out of wedlock who had paternity established or acknowledged during the federal fiscal year, and then dividing that by the number of children who were born out of wedlock during the prior federal fiscal year. So it's kind of a comparison of current year paternity establishments versus how many children were born out of wedlock the prior year. So we set a number of internal goals throughout each year, and during federal fiscal year 25, we exceeded the internal goal that we set for increasing current support paid. We had a goal of achieving at least 61%, and we exceeded that by ending the year at 61.35%. We also exceeded our internal goal for support orders, which was to increase our performance to at least 90.5%. We really exceeded that one by ending at 91.27%. For arrears paid, we had set an internal goal of 66.7%, and we fell just short of that at the 66.56%. And for paternity, last year, as well as many years before that, our goal is to reach 90%. That is a federal requirement to reach 90%. And we ended just short of that at 89.46%. So I'm very excited about the increases that we saw for current support arrears and support orders in 25 versus 2024, and really proud of our team's efforts for those measures. Our team also did a lot of really hard work for paternity establishment. We just couldn't quite make it to the 90%. And on the next slide, we'll take a look at some of the challenges we faced there. And a little bit further, we'll talk about some things we're doing to continue increasing in paternity. So the Personal Responsibility and Work Opportunity Reconciliation Act of 1996 requires states to maintain a paternity performance rate of at least 90%. So because we did not achieve that 90% in 2025, we are now in a corrective action plan year. And so basically that means we'll need to achieve 90% during federal fiscal year 26 in order to avoid any kind of financial
Yeah,
penalties.
can I ask, is there may be punitive measures if we don't
Correct.
reach those
If we don't reach the
federal goals.
That's correct. If we don't reach the 90% this year, then the state could face a 1% to 2% penalty to the TANF block grant. So of course, it's very important that we do. We have been in this situation before where we've fallen below the 90% and then we've been able to meet the 90%, and that's the corrective action plan year. So, and we're working on quite a few things to make sure that we do that. So some of the challenges that we faced with paternity during 2025, which resulted in us being just shy of that 90% mark, are outlined here on this slide. So I'll go through these items. So states have the option to calculate paternity establishment performance in two different ways. And Georgia currently and historically has used what's called the statewide paternity option. This option relies heavily on factors that we have very little control over as a division. So the calculation for the statewide paternity reporting considers the number of children who are born out of wedlock in Georgia during the prior year, and then this is the number we have to achieve 90% of. So one of the factors that influenced our performance was in 2024, the number of children who were born out of wedlock increased. So that resulted in us having to establish more paternities than some prior years. Also, of our overall paternity performance, the paternities established for that statewide option come from, the majority of them come from the external sources versus our division's performance. Over 90% of that total paternity outcome comes from external sources. And we saw a decline in both the number of paternity acknowledgements signed as well as the number of paternities that were established through adoptions and legitimations during 2025. So with those external factors making up the majority of our performance and then seeing a decline in them, that had a huge impact on our final number. Also in Georgia and also nationwide, we are seeing a decline in the number of new intakes that we receive. And we also have some challenges with custodians not returning documents that are needed to proceed with services. So as was mentioned earlier, we sometimes have trouble reaching our customers when something is needed in order to move forward with the case. I know that's true on the DFAC side, it's true for us as well. And so that can cause a challenge if we need something on that case in order to be able to move forward with paternity establishment. And that something may be the mother and the child showing up for the paternity testing appointment, or the putative father showing up for the paternity testing appointment. So all of these factors have had an impact on our performance. And on the next slide, we'll take a look at some of the strategies we're working on this year in order to ensure that we achieve that 90% performance. So one of the things we did in 2025 was we reinstated our DCSS Performance Task Force. And this is a group of subject matter experts throughout the state who come together and really work on initiatives to improve performance in all areas. But one of the main focuses, of course, is paternity. And so that's been a really great thing. They've had a lot of brainstorming sessions and come up with a lot of really great ideas and initiatives for our teams to focus on this year. Also, we're holding monthly paternity summits, and this is an opportunity for our local offices to get together, report progress on paternity establishment performance, share challenges, and also highlight successes so they can learn from each other, learn from what different offices are doing, and take those ideas and implement them throughout the state. In addition to that, I know there was a question earlier about, best practices from other states. And so I am on multiple calls throughout each month with other state directors, child support directors, as well as our federal partners are often part of the calls as well. And so I have the opportunity to kind of brainstorm with my peers, my colleagues, on things that their states may be doing, especially if there's somebody that performs really well in paternity, making sure that we're reaching out and finding out what are they doing. And we also have some regionalized meetings too with our federal partners and other states in our region. So that's always
Thanks for
helpful.
answering my question that I was gonna ask.
Absolutely. Another thing we're working on is outreach. So with a lot of our performance coming from entities that are outside of the division, we also do a lot of outreach with our hospitals and with our birthing centers to make sure they are stay up to date and informed on the importance of establishing paternity so they can pass that information on to the parents that they work with. And not only the education piece, but also the importance of the timeliness in entering any paternity acknowledgements that are received from the parents. Also, every month we get a list of children who were born out of wedlock from the Office of Vital Records. And so we review that information. And for any parents who have not yet completed a paternity acknowledgement form, we make sure to reach out to those parents to educate them on the importance, the availability of that process, but also the importance of establishing paternity. And we provide them with instructions in a blank form. So if they choose to do so, they can complete that process and return that form. So in addition to these efforts, we're going to continue striving to achieve that 90% based on how we currently report. But we're also looking into the other way that states have to report paternity, which is referred to as the 4D paternity reporting method. So the 4D refers to Title 4D of the Social Security Act, which governs our child support program. And so it's an option either for states to report based on the statewide paternity metric or based on the 4D. And so essentially, we are looking at the option to switch reporting methods during this federal fiscal year. And I'll go into a little more detail on what that would look like and some of the benefits and the risks as well in making that change. But before we dive into that 4D option, I want to just highlight a few of the creative things our offices are doing to keep paternity at the top of the mind. So on the next slide, you'll see some examples of some of the visual motivations that we have throughout our offices in the state. They're using creative visuals to track their progress towards their paternity goals and to motivate their team members and keep them engaged throughout the year. So we held our first 2 paternity summits in December. And during the summit, some of the offices shared some of these pictures with us, shared examples of what they're using to keep their teams engaged and excited about reaching their paternity goals. So just one example I'll point at is the DeKalb office. They have you can see the baby bottle there. And so what they do is as they establish paternities, they add another baby to the bottle. And so throughout the year, you'll see it increasing. So it's a good visual reminder and a fun way for them to stay engaged throughout the year. So on the next slide, we'll take a closer look at the 4D paternity option that I mentioned. So switching paternity establishment performance options in 2026 could provide us with several benefits. One is the 4D option measures paternity establishment only within our child support program. So whereas right now we have to rely on external entities for the majority of our performance, this would really be just our caseload and we would have control over our performance, greater control over our outcomes. Also, shifting to the 4D option would allow for a broader range of targeted strategies to improve performance. And then one of the most important things is historically, our performance for that 4D measure has been significantly higher than the statewide paternity option. For example, we ended federal fiscal year 25 with 96.93% in that 4D paternity method. And so even I was looking at our numbers this morning, it looks like we're going to hit 90% this month for that 4D option. So we would likely hit the 90% much earlier in the year and then maintain that throughout the end of the year. So this higher and more stable performance would significantly reduce the risk of us falling below that 90% federal performance threshold. With the statewide option we currently use, we are when we do hit 90%, it doesn't come till that last month of the year. So it would definitely put us in a better place earlier in the year to meet that 90% and to maintain that 90%. However, switching the paternity reporting option is not without risk. And so the most significant risk involves audits that are conducted by the Federal Office of Child Support Enforcement. And so currently, just the routine audit process would look at 1 year's worth of your paternity data. But if a state decides to switch their paternity reporting option, the federal office not only audits your current year's data, but they do a 2-year look back. So they would also be looking at our data from 2024 as well as 2023. So to mitigate this risk, we have conducted preparatory work over the past several years to ensure that our data is reliable. And our policy and paternity unit is currently gathering and reviewing data to assess the potential audit impact. We have very stringent internal audits. We have a team, our performance management team, that conducts internal audits for us. And so we anticipate the overall audit risk to be low because of that stringent internal process that we have. Additionally, because the 4D paternity option is calculated using a smaller caseload than looking at the statewide paternity, if there are any changes in trends, even small changes, that could have a larger impact on our overall performance for paternity. So that's just one other risk that you have if you switch to that method. So we're going to continue to evaluate this option and our performance over the next several months, but we are definitely seriously considering making that change. And we think it is likely time to make that change to put us in a better position. So with those were the performance updates I wanted to cover, but I did have a couple of additional program highlights I wanted to share with you all. So starting off with the mobile app. In federal fiscal year 2025, we collected a total of $57.5 million through our mobile app. So that's customers who were logging on and paying towards their child support case using the app. This is the second highest year of collections received through the app since we started tracking the app collections, which was back in 2022. Also, we're finding that electronic wallet payments, or they're called e-wallet payments, are becoming increasingly popular with our customers. And so we currently accept e-wallet payments from PayPal, Apple Pay, Venmo, and Google Pay. And 16.7 million of that $57.5 million in collections via the app came from e-wallet payments, which is almost a $4 million increase in those e-wallet payments since 2022. Apple Pay seems to be the most popular. So we had close to $12 million in Apple Pay alone, payments via Apple Pay. Our mobile app users also increased to over 181,000 unique users during state fiscal year 2025. And our strategic plan goal for 2026 is to reach at least 185,000 users. And then finally, we had a number of team members who received recognition throughout the year. And so I wanted to highlight a few of those for you all. So our Georgia Fatherhood Program was awarded the National Child Support Engagement Association, or NCIA. We have a lot of acronyms, so I wanted to say what all those letters mean. The 2025 Program Awareness Award. And so this recognized the fatherhood program for its outstanding outreach and public education efforts, which have significantly raised awareness about child support services in Georgia. So they do a lot of conversations, which are available online to customers throughout the state. And they not only talk about the services that they offer through the fatherhood program, but they highlight a lot of other services that we offer to customers. They talk about the mobile app, they talk about access and visitation services. So they really do a great job spreading the word about all of the work that we do. Also, Antoinette Vinson, who serves as a child support specialist supervisor with our Chatham County office in Savannah, she received the NCIA 2025 Emerging Leader Award, which honored her exceptional leadership and contributions to the mission of Georgia's child support program. Candace Hayes, who serves as our central registry manager, she was the recipient of the NCIA 2025 Judge Ross Scholarship, and that was for her demonstrated potential to enhance team performance and contribute to the continued success of Georgia's child support program. Also, DeKalb County Uniform Interstate Family Support Act, or UIFSA, manager Camilla Miller received the 2025 Western Intergovernmental Child Support Engagement Council Leadership Achievement Award during the organization's annual training conference. And this award recognizes individuals in leadership roles who have made significant contributions to improving organizational outcomes, workplace culture, and staff development. And finally, I'd like to highlight the graduation of 6 NCAU participants from our DCSS team. They included Derek Brandon, Carla Clemens, Carolyn Davis McKee, Tracy Irwin, and Candace Hayes, and Dondra Samuel. NCAU equips child support professionals with essential tools to enhance their performance and leadership. Our graduates are empowered to drive transformative changes within the child support program. And I'm excited to see the continued impact of the NCAU class of 2025. And I must say, I've been through that class. I went through it, I think, I went through it twice. The first time was back in 2015 or 16. And it really does give you a lot of great leadership skills, but also the networking with other child support professionals from other states is a really amazing part of that program. So really proud that we were able to have such a large number of attendees participate this past year. And so with that, that's all I had for today's presentation, but I'm happy to take any questions you all may have for me.
How long did the class take you?
So it is held in conjunction with one of our national conferences. So it's
Oh,
usually,
okay.
the in-person portion of it is usually only a couple of days, but they do some work leading up to those in-person classes. They have some virtual sessions. And so there's kind of some homework you have to do outside of the leadership class. And then you have a lot of work during the in-person sessions as well. They usually have 2 instructors who are child support professionals, have been with the program for years. In fact, one of our former directors and the former federal commissioner, Tangela Gray, she served as one of the recent instructors. So yes, so the class that just graduated, they had the benefit of having her as one of the 2 instructors. So
Uh, Thanks for recognizing these great folks and the graduates, but also award winners. We appreciate this award, the staff, DHS staff does. And we don't say that often enough, but we do. And I wanted to ask you, the Family Accountability Court,
parental accountability.
does that continue to be a positive program?
Absolutely.
I don't know if it's throughout the state now in every Superior Court district, but if it's not, I know that I remember when it was a new program. I've been on the sport a while, and but is it continuing to be effective?
Absolutely. So we're in 45 of the 51 judicial circuits throughout the state. So we're almost statewide. We are working diligently to get there. It continues to be a very positive program, we get a great return on investment. Even when people are just referred into the program, we see an increase in their child support payments. So regardless of if they end up graduating from the program, just being referred in, we see an increase in their child support payments. I had the pleasure of attending a graduation in Henry County in December and got to speak with one of the graduates, and he was just saying how much he appreciated the program. The support and the structure really helped him to achieve some of his goals. And so he's working full time, paying his child support, doing really well. So it does continue to have a really positive impact on families and on the parents that are part of that program.
Good. Well, that's good to hear. And Judge Ann Harris in Cobb County keeps telling me, I want you to come to one of my graduations.
Absolutely.
And I'm going to do it one day. And I hope we all will take the initiative to do that because I know that they're very positive, and they're positive for the child that's now receiving child support on a regular basis, but also the payer, the parent that has come in line and is doing something positive for themselves as well as their family.
Absolutely. And the judges too tell us how much they enjoy overseeing the program because it's something positive. You know, a lot of times the cases that they're dealing with are very, not just child support cases, but a lot of the superior court cases they have to deal with are, as you can imagine, very taxing and very challenging. And so this is something where they can see face to face the positive outcomes from the work that they put in and that the participants put in. So it's a really great thing for everyone involved. And it's certainly one of our favorite things to attend are the graduations and to hear the stories. And even the office that was at the graduation I attended, I could hear them saying, "Oh yeah, I remember when he entered the program," and just seeing the changes. It makes them want to refer more people in as well, seeing that positive outcome.
Good. Well, our accountability courts and our adoptions that they get to do are the good part of what the
Absolutely.
work that our Superior Court judges do, and we appreciate that as well. Any other questions? Any of our board members that
Thank you so
are joining
much.
us online? Okay.
Thank you.
All right,
Yep.
I appreciate it. Sarah. We're gonna take a break, but first we got a couple of administrative reports that we want to get done, and that's the Office of Facilities and Support Services, excuse me. You're gonna talk to us about some action here in Cherokee County, I believe, and welcome. I'm sorry.
I'm Perry McMillan. Pleasure to meet you again. Yes, sir. And I am the director with the Office of Facilities and Support Services. And I want to talk to you all today about a board resolution in support of approving a sewer easement in Cherokee County. If you hit the next slide for me, please. And what we're proposing is a resolution to support the approval of a 20-foot easement that crosses the property line of Cherokee County DHS for the purposes of providing sewer access to Cherokee County's Transportation Department. They're constructing a new building, and they need that sewer access to work. DHS is in support of the State Properties Commission's issuance of a revocable license agreement and their efforts to seek the granting of a non-exclusive easement to install and maintain the sewer easement in Cherokee County. And so why is the board resolution being requested? Because the state of Georgia owns the property, which is located at 1300 Universal Road in Canton, Georgia, and DHS is the custodian, which means DFAX actually occupies the building. The State Properties Commission serves as the tenant of the property, and they will issue a revocable license agreement to Cherokee County, and eventually they will request a grant by the General Assembly of a non-exclusive sewer easement. The SPC requests DHS's support of this project via board resolution to issue a revocable license agreement and request a grant of an easement that crosses the property of which DHS is custodian. There will be no disruption or interruption of services with this sewer easement because it kind of cuts toward the rear side of the building, so there will be no disruption in services. So the request of the board is to adopt a board resolution to support this issuance by SPC of a revocable license agreement and a subsequent request to the General Assembly of a sewer easement for Cherokee County for the property located at 1300 Universal, which DHS is the custodian. And that's it in a nutshell. I'd be happy to answer any questions.
Any questions?
I don't have any questions.
Any board members here, or any of those online? Well, sounds like a good neighbor thing to do, and the
Yes.
board will consider it shortly here.
Thank you, sir.
Consider the request.
Thank you all.
Okay, and the Office of General Counsel has a rule change proposal. Byron? That was your request.
Good afternoon, board. Hi, I'm Byron Cuthbert. I'm the Associate General Counsel assigned to the Division of Child Support Services. And I'm here today to request a motion to to publish our new amended rules for the Division of Child Support Services. So the roadmap today is we're going to review the rule change procedures, and I'm going to give you some highlights to our proposed amendments, and then we'll request you to the board. So our rule change procedures. This is step one for it, which is for you all to consider to publish our proposed rules. After that, we'll go through a 30-day public comment period, which will include a public hearing. And after that, we'll come back to the board for a motion to final adoption of proposed rules. And then we'll send the final rules to the Secretary of State for publishing. Okay, so first I want to note that this is actually the biggest proposed amendments to our rules since the publishing of our rules since 2013. It was an extensive process where our Office of General Counsel, our Division Public Policy Unit, met with the Attorney General's office, some of our SADs, met with multiple divisions to go over and make sure that our rules align with the state and federal law. One of our proposed amendments is actually changing the name of the chapter of the rules. And we changed it from the Office of Support Recovery to the Division of Child Support Services to align with our current name of our rules. Slide. All right, so the other one of our other rules is going to be updating our definition section. We're going to be aligning a lot of our definitions to align with the state and federal law. We're also adding a lot of new terms. One of the terms that I want to highlight that we're adding is the period of time adjustment. And that's because that concept just came effective in Georgia law January 1st of 2026. We're replacing some other terminology and we're just adding some clarification for some of the other definitions. Next slide, please. So establishment. For establishment, we provide some clarification when paternity is appropriate. We clarified the procedures for genetic testing, and we clarified some of the provisions for our public assistant referrals as well as our consent agreements. And as I stated earlier, we updated terminology to align with state and federal law. Next slide. So Rule 6 is about review and modification. In this rule, we clarified that our Georgia authority is 1911-12. We also added a definition of what's considered reasonable cost medical coverage. That aligns with the federal regulation, and basically what it explains is that in order for it to be considered reasonable, it cannot exceed 5% of the individual's gross income. And that's the main review and modification. Next slide. This rule, we updated the name. We updated the name to license suspension and limited driver permits. We added a lot of clarification language to the limited driver permit terms and provisions. When we initially did it, it was pretty bare bones. So we went through and thoroughly provided what the criteria and what the review standards are going to be for those. We also explained about the administrative hearing process concerning the limited permits in this section. Next slide. Last highlight for us is Rule 15, which is about allocation and redirection payments. And this was basically a big clarification to a lot of these rules. We clarified the allocations for multiple obligees to align with the federal regulations. We also provided how redirection could be applied to arrears as well as different custodial arrangements. And last, we clarified the administrative hearing process when it comes to redirection. So as I stated earlier, after you all consider our motion, if you approve it, we'll go through a 30-day public comment period from January 8th through February 7th. We also will be holding a public hearing to the public on January 13th at 1 p.m.
At what location?
Here. And 47 Trinity. Okay. So now I respectfully request you, the board, to consider a motion to publish the notice of rules.
We'll do that. We'll do that. We'll do that
In our business meeting.
Thank you so much.
Yeah, thank you, and I know you all
Thank
have put a lot of work into
Yeah.
curating these updates that are needed, so
Yeah.
thank you for you and the team. Doing that. Unless there are any questions, we'll.
Thank you so much.
Yeah, very good. Okay. Well, we are at 1 minute till 3.
Yeah.
And we'll take a 10-minute break
All right.
Okay.
and resume here at now it's gonna be 3:10.
3:10.
And we will resume our board meetings for purpose of business. All right. We are in recess. Okay, let's call the Department of Human Services Georgia Board Meeting to order. It is 3:12 p.m. January 7th. We've heard good presentations from staff today, and I appreciate all their engagement and all the work they do to support the board. And it's certainly our goal to support the staff and the department in every way that we can. Part of our presentation this morning have been proposals for by the administrative report. The Office of Facilities and Support Services presented a proposed sewer easement to Cherokee County, and I'll present it as this. The board will now consider the adoption of the proposed board resolution in support of the approval of a sewer easement to Cherokee County for property located in Cherokee County, Georgia, of which the Department of Human Services is the custodian in accordance with the provisions of OCGA sections 49-2-1 and 50-16-38. Is there a motion?
Mr. Chairman, Dave Barbie, I would like to make a motion that I move that we propose the proposed board resolution to support the approval of a sewer easement into Cherokee for the property located in Cherokee County, Georgia, of which the Department of Human Services is the custodian, to be approved and adopted.
Is there a second?
Second.
The motion's been duly moved and properly seconded, and the proposed board resolution in support of approval of a sewer easement to Cherokee County for property located in Cherokee County, Georgia, of which the Department of Human Services is the custodian. Move that it be approved and adopted. Is there any discussion further? Hearing no discussion, we'll take a vote. All in favor reply in the affirmative, aye.
Aye.
And there's 5 votes in favor, at least. So the resolution in support of the approval of a sewer easement to Cherokee County for property located in Cherokee County, Georgia, of which the Department of Human Services is the custodian, is hereby approved and unanimously adopted by this board. Okay. Our next item of business, the Division of Child Support Services rule change. And we will vote on this after a motion. The board will now consider the proposed rule changes from the Division of Child Support Services related to Rules Chapter 290-7, Office of Child Support Recovery, Rules 290-7-1-.01 through 290-7-1-.20, collectively referred to as Rules Subject Recovery and Administration of Child Support of the Rules of the Georgia Department of Human Services. Is there a motion?
Mr. Chairman, Monica Walters, I move that the proposed amendments to the Rule Chapter 290-7, Office of Child Support Recovery, Rules 290-7-1-.01 through 290-7-1-.20, collectively referred to as Rules Subject Recovery and Administration of Child Support of the Rules of the Georgia Department of Human Services, to be published for a 30-day public comment period.
Mr. Chairman, Dave Barbie seconds the motion.
Okay, the motion has been it's moved that and properly seconded that proposed rule change from the Division of Child Support Services be approved for publishing for a 30-day public comment period. Is there any discussion to this further?
No.
All right, we will take a vote. All in favor of passing this motion and posting the rule changes for the public meeting and comment period, please say aye.
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 And it is unanimously approved. Okay. You have received the minutes from the October 8th board meeting. They have been distributed to you board members. Are there any corrections or is there a motion to approve?
Mr. Chairman, Dave Barbie, I move that the Board of Human Services minutes for the October 8th meeting be approved.
Okay, it's
Second.
been moved and seconded. It is moved and properly seconded that the Board of Human Services minutes for the previous meeting be approved. Is there any discussion? We will take a vote at this time. All in favor, say aye.
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 Okay, very good. All right, we have unanimous approval on the for the minutes of the previous meeting. All right, if there, we will now take a moment for new business, and I want to mention, and I mentioned it earlier, that thank you for this department and thank you so many at Georgians for what was done for Clark's Christmas Kids. It was great to see it once again in action. Thank you for the staff that showed up. And it was good to see you at Walmart in Marietta. And one of those folks that I had a chance to talk with for a good little while there was Lamarva Ivory. Lamarva, I believe this is your last, this is the last hurrah for a board meeting for you. And I want to point that out. How many years have you served at Georgia Department of Human Services?
36. Yeah.
36 years, and you briefly kind of shared that. For all those online and all those here, we want to thank you and recognize quite a career serving children. Thank you for that, and it was good to catch up with you at Clark Christmas Kids, and you talked about some about your career, and we just heard earlier, I mean with John, we had more people with longer tenure to understand how the department operates. And you're a great example of knowledge over a long tenure. So we appreciated that. There's probably other retirees that deserve recognition, but thank you for being here with us.
Thank you so much. I say this has been the privilege of my life to serve this agency and the citizens of Georgia. So thank you all.
Thank you. I know there's more things that we can discuss and more things that we need to do. I don't know that they'll occur today, but they will need to occur in the near term. I will remind you all that the legislature goes into session next Monday.
Yes.
For better or worse. Just kidding. House and Senate members. And there'll be a new budget for the coming fiscal year. And I hope that the well publicized shortfalls that
Yes.
the department has experienced and that we're headed for this year. And not put out a number because I don't even, the number not is even established. I know what, you know, what we hear and the media recognizes and look, I don't read everything, I believe everything I read, but I know we've got some challenges. And I hope that the coming budget reflects supporting and taking care of the most vulnerable children in Georgia, because that's who this department is about.
That's my concern, Mr. Chairman, is that we have this shortfall. And as you said, we just have what been published in the news media or whatnot of the number. We don't have any idea, but I'm truly concerned because our job is to protect the child. And that's why we've been here. And I am truly concerned in how we're gonna come up with a shortfall.
Well, and I know the commissioner feels it.
Yeah.
And as concerned as we are. And I know we've got good and concerned people in the House and in the Senate and in the governor's office. And I know they recognize, and I know we are sometime pilloried in the state by changes that are made at the federal level. I understand that. And cost increases. I understand that. And I think we all do. We all experience them in our own lives. And it's the federal government, it's hard to tell what will happen next sometimes, although their efforts are laudable in many ways to secure that support and measures to combat fraud are enacted. We have to react to that as a state, and I'm confident we will. But I look forward to seeing that happen
Well,
in the upcoming legislative
Well,
session.
the issue's been brought forth before us, and it's sort of like finding yourself in a big hole. You gotta stop digging. And my main concern is, okay, we can't change history. Let's go forward to fixing the problem and doing what we have to do.
I agree.
What we don't have an option of is not caring for the most vulnerable children in the state.
That's
Right.
correct.
People in the state, whether it's
Bottom line.
old folks like some of us, present company accepts that, or our children,
That's correct.
because they belong to Georgia, and we are Georgia. And we shall monitor that closely. I'll share one more story with you. I reconnected with someone recently that was she's actually a former high school friend, if you want to know how far that goes back. And at a reunion, and she didn't even know I'm involved in this in this board. It came up in conversation at dinner with my wife and I, and she and her husband, talking about. She said, "I had an angel. I saved my life one time, and I can see I can see it right now." She said, "I was the oldest of 9 children, and I was with a water hose in the backyard with some of my younger siblings, and if I've got it right," she said, a lady walked up to me. I'd never met her, and but I can still see her right now." And she said, "To me, she was an angel." And she said, it was a very difficult family situation. And that person walked up to her, that lady, and said, "Hi, here's my card. I'm from the Department of Family and Children's Services." And, and she said, "Lady saved my life." And, you know, I told her, thank you for sharing me. I'm love to have her here to share her story. Maybe we can do that one day. But now it's a long time ago, so maybe nobody in this department, but maybe Lamar, I don't know, was in the department at that time. But she said, that lady, that person, she was an angel to me because she saved my life. Because she got me and my siblings out of a desperate situation. And it was, she had been tipped off, the defects worker had. But sometimes we don't give credit enough, or we only hear the bad side. If something goes wrong, that's what we hear. But there are angels out there that are saving kids' lives. And a bunch of them work in this department.
That's correct.
And
I agree with you.
I want them to know, and Georgia to know, we appreciate them.
Yes.
They're under-recognized and underappreciated, but let's take a moment when we have the chance to say thank you.
Thank you, Scott.
Anything else that you all have to offer?
Thank you for those words.
Thank you for that.
Reiterate.
Thank you, Chairman.
Our board members online, do you have anything, do you have any more things to offer in this new business closing comments?
No, this is Jack. I just wanted to say the same thing. Thank you for those words. They mean a tremendous amount to all of us.
Well,
Hear, hear.
I just, they're just something that was conveyed to me by someone that experienced it. And I know we all deeply appreciate the work that happens. Thank you all board members for the opportunity to serve. I know that served with many of you several years, and we continue to do good work, and we will do that in the year 2026. And hearing no other contributions to this meeting, I'll have a motion to adjourn. Is there a motion to adjourn?
I make the motion, Mr. Chairman.
I'll second it, Mr. Chairman.
And hearing a motion to adjourn and a second, any discussion? Hearing none, all in favor say aye.
Aye.